Them. Oh, here we are. Hello, welcome to Haluna Health's Population Health Matters live stream. I'm Elizabeth Power Robison, Chief Advancement Officer at Haluna Health. I'm delighted to be joined for today's live stream by artist Lalo Alcaraz and Dr. Ilan Shapiro to discuss culturally connected approaches and population health messaging. I'd like to start by introducing our guest, Lalo Alcaraz, a writer, producer, and award-winning cartoonist known for his comic La Cucaracha, the first nationally syndicated, politically themed Latino daily comic strip. Lalo has worked on projects at Nickelodeon, Cartoon Network, Disney, Fox, and Xbox. And he's also worked with numerous organizations producing socially relevant health content, including the California Department of Public Health to address vaccine hesitancy in the Latinx community. He's partnering with Haluna Health to develop original content on maternal care, nutrition, and early literacy. Lalo, thank you for joining us today.
Thanks for having me.
Great. I'm also delighted to be joined here today by Dr. Ilan Shapiro, the Chief Health Correspondent and Medical Affairs Officer for AltaMed, the largest nonprofit FQHC in California, providing medical and dental services to mostly low-income Latino, multi-ethnic, and underserved communities in Los Angeles and Orange counties. Dr. Shapiro joined AltaMed in 2016 as Medical Director of Health Education and Wellness after working for the Mexican Secretary of Health as a liaison between Mexico and the WHO. A frequent health expert on national television and radio, Dr. Shapiro has the American Academy of Pediatrics Holroyd Sherry Award for his ability to leverage media to deliver important children's health information. Thank you, Dr. Shapiro, for joining us. Great. I'm going to kick off today to tell you a little bit about Haluna Health, as we're leading the effort to eliminate health disparities for people living in vulnerable circumstances and creating change in systems and policies to improve health outcomes in every community we serve. We've invited these two highly respected leaders in their distinct fields to share how they build trust and connections as an artist and a physician through their unique population health communication approaches. We invite you to submit questions in the chat, and we will do our best to incorporate them into the conversation. And I also encourage you to watch Lalo's video called Super Doulas on Haluna Health social media channels and Vimeo, and we're grateful for that partnership. I would like to kick off with our first question. And I'll start with Lalo. We'd love to hear your perspectives on the importance of making cultural connections when communicating population health messages and how you've developed your talent in reaching out to diverse communities.
Hi, well, happy to be here and impart any tiny knowledge I have about this, but it's been on-the-job learning, but it's really applying kind of how I work with editorial cartoons and how I communicate, heavy messages with a light coating of humor or of kind of cultural relevance, and messaging about doing something that you really don't want to do, which is, go get a shot or put on a mask or protect your, neighbors. It's the same as any hard political topic, and you need to draw people in with some cool imagery, maybe something familiar from that group's culture, and maybe a little bit of humor, a little bit of lightheartedness. As my mom would say, algo llamativo, something appealing to get this message out. And sometimes it's just as simple as putting a brown face, on these, on the artwork that exists out there already. The messaging, a lot of it is kind of for the general population, but it really doesn't have our communities in mind. And sometimes you have to put familiar faces on there, and I don't just mean like a celebrity or something, but you have to have people that look like the community depicted in these messages.
Excellent, thank you. And Dr. Shapiro, I'd invite you to respond as well. I know you have worked hard to make those cultural connections.
Elizabeth, one of the things that when I drive on the highways and I see Lalo's art there, it's translating what I call medicalish. When you go to a doctor, even me as a doctor, if I go to another specialty, and it happened with my wife that she had a thing with her hip, and you start hearing a lot of things, and you end up hearing a different language called medicalish. When you hear medicalish, your brain disconnects, because unless you get a translation, unless you get like actionable things with that conversation, the entirety of that thing, it sounds like alienish. It's a different thing. Then one of the important things that we need to create is that bridge between that hard and thin concept called medicalish to actionable things to our community. My only mission and the things that we have been doing for the past years is making sure that our community, understanding that que están chambeando mucho, they are running from one job to another. There's not a lot of time to debate. It's at least give them the information needed to do something. If they choose to go one way or the other, at least they had enough information to make a decision. I hate, and one thing that happened with COVID-19, it's happening right now with obesity and depression, is sometimes our community, because of fear, we get paralyzed. We don't do anything. Instead of actually deciding, well, this is an option and it could be this way or that way, but at least opening that door of a conversation where they can go with their doctor better informed. They can actually choose to do a treatment or not, or choose a better treatment. That actually helps create education, wellness, and empowerment of our community.
Excellent. Thank you so much for sharing that, both of you. And you talked about this issue of medicalish, and I know, Lalo, you do a lot of translating through your art, trying to bring the message to the population in a way that they're able to receive it and understand it. What have you heard from the community in response to your messaging, and what would you like to see happen in population health communications so that we can further advance health equity?
Sure. I think the doctor mentioned the mural is like a mural that we all did for boosters, for COVID boosters, and it's still up, and it is over the 110 freeway here in Los Angeles, and millions of people have seen it, and it's the biggest thing I've ever done. I think we have to get people, and it features like a simple characters, but they're reflective of our community. And it's what I really like is people say, I saw your thing, I knew it, I recognized the style, and there it is, and it's still up there. And that we have to get people used to messaging. And also, yeah, the doctor's right about getting things quickly to people. When I do a cartoon, it takes you have about 4 seconds to get their attention. You have the reader for about 4 seconds, so you got to be punchy. I think that we have to go out and also talk to the community and know, live their life a little bit. What are they going through, and how can we reach them best? I met some incredible promotoras up in the Central Valley who go out to the SWAT, at least during the pandemic, would go out to the SWAT meet at 5 a.m. on Saturdays and Sundays, and go where the people are. And also, they are the people. They don't talk down to the community. They are, they're horizontal with the community, and they know what they're going through, but they also listen to them, and then deliver the message right here like a hot tamal and a champurrado, both kind of unhealthy things. Sorry. but deliver them in a way that the people see and understand. So don't talk down to them, and I think that will go a long way.
And it's interesting, you're both sharing the importance of the ability to connect culturally, but I also think the mediums that you're using art as a medium to reach people and to resonate, and social media as another tool of connection. How do you think the use of the forums that you're creating helps carry the message, in addition to the cultural connection? Just the forum thereself, I'd be very interested in.
Can I just say real quick, I have some not health, well, I guess it is health messaging. Did some work for the city of LA, and we did 300 bus stops with an image that I repurposed an old kind of clip art looking poster about heat stroke, and then just redid it in my style, added a brown female to the poster, or transformed her from a clip art human to a more specific person. Specificity is universality. It applies in literature, art, movies. It applies here. If you want to reach that community. And where did we reach them? On, outside in the heat, and at bus stops. And also, if you're driving by, you can see the image is so big. You could see it's like 300 mini murals all over LA city limits, which is not a small space. So it's that's one way. And I already forgot.
Great.
Elizabeth, one of the things that I have learned is that more than me talking, it's actually hearing what's the real problem. And Lalo is actually mentioning something interesting, because what are the classic books that tell us, well, me as a doctor, they need to hear us. Me as a healthcare, whatever system, they need to hear us. But it's not that they want or they don't want. The thing is, having 2 or 3 jobs is hard. Having also to take care of the kids is hard. Also, like all this stuff that it's happening around us, depression, anxiety, COVID-19, economics, then there's a lot of misinformation there that is already part of the system. Then at the moment that you want to have a conversation, and by the way, I call it a blessing each time, and a humble experience when I see a patient or I get to talk with a community, because they are giving me their time. Most of the times they actually forfeiting a check because, it's day by day. And I need to make sure that I'm hearing and understanding what they need. Sometimes, and it happened a lot with vaccines. A lot of the community members actually wanted to get vaccinated. But the thing was that, well, it's not in Spanish. It's not easy to get access to it. Or if I have access, what do I do with the kids? Having like 400 chamacos running around on the office when you're trying to vaccinate mom, it's not the best thing that you have. Then trying to figure out what can we do outside of what was written, outside of the box, and make sure that we're providing that in a cultural matter that resonates. Maybe it's in Spanish, maybe it's in Mandarin, maybe it's in whatever language we want, but needs to have that cultural touch. Because if you see the murals and the amazing stuff that Lalo is doing, it speaks to everybody. It speaks to everybody. It has a touch. Of course, it's geared to a certain population, but it's universal. Then that's my job as a doctor, as a human being, to make sure that at least I'm opening that door, hearing what's actually needed, and also, catering that to, diabetes care, obesity, depression.
Oh, we lost Dr. Shapiro.
He's just thinking real hard.
Thinking really hard. I don't know what just happened to him. Maybe he'll come back and join us. Lalo, I thought I might take this then as an opportunity to ask you to share a little bit about our collaborative project, Paquita's Garden, and the importance of creating messaging around nutrition and literacy, and your passion for population health, kind of what that originated from.
I had been thinking that things like food deserts and malnutrition, they're all a problem that we have to deal with. And I think I really kind of started thinking about it after a certain movie about a certain snack product got like, really kind of polarized people. Uh, and, but I have been thinking about food all the time because I love to eat. And I'm a big fan of like, Bourdain and Chef Jose Andres and all about how food gets to people. I think that's like super fascinating. I'm not a foodie person. I'll eat anything you put in front of me, but I love eating new food or whatever. But I think that our populations, especially our urban populations, don't understand. I think what goes into getting food, what is good about food, what's bad about food, and we could all use a little more education on it. Me too, and so I'm fascinated by the farm worker movement and their lives and how food gets from farms to our tables. And I came at it from the labor aspect of it, but I think that our folks in the community could use a little bit of education on that. So we created Poquita's Garden, this story as a kid's book that we're going to put out. And hopefully even expand it to every form of media possible as a story of an urban garden that a little girl starts in the city when they move away from the food cradle, the Central Valley, move out to the city, and she kind of creates this little garden that attracts everything: people, insects, animals, and attention about food. So it's it's making me hungry now.
Thank you. And welcome back, Dr. Shapiro. Sorry we lost you there, but delighted. I know we're running up on our time here, but I'd love to invite you to share any closing thoughts you have on this important message of population health and community connections and building trust.
I can tell you, Elizabeth, that as a physician, I have been through a lot and more in the frustration, because I tell my patients, you need to eat better. You need to do exercise. And of course, my patients know that. They know that they need to actually do that stuff. They need to do healthy stuff, sleep better. But what happens when they leave my office? Well, they go to a community where they need to choose between the green stuff and actually something to take care of the hunger of the family. They go to the green space, if there's a green space, and maybe it's not secure or safe for them. Or, between everything else, it's not a supported system around them. Then population health matters. It's talking about social determinants of health. It's having that conversation and how to be represented. It's also what can we do as a community to move this message, and also make sure that we are, as we say in Spanish, pasarnos el chisme. How can we actually share our message from one person to another and be effective to create a wellness culture, a way that we can all improve, and also being the example and move a lot of the stereotypes that we have from the past and use the good stuff that we actually have, the family values, the way that we take care of each other, the laughter that we have inside of us. Then we have a lot of things there that we can manage, and most importantly, connecting the dots. If it's vaccine, if it's talking about depression, if it's talking about diabetes or obesity and weight problems, if we are united and we're pasando la voz, if we're actually passing the message, I think that we as a society can create a better future for us, and most importantly for our kids.
Fantastic. Well, thank you both so much. And I'm grateful that you joined us for this live stream chat today. We're so proud of the work both of you are doing in our communities and the impact you're having. And we look forward to staying connected. And we invite our viewers to follow you both on social media. I see your handles are on the screen. And also to follow at Haluna Health for future Population Health Matters conversations. Thank you both for being here today.
A pleasure as always.